They were approaching lunch with a completely different...
No, they were not approaching lunch, they were approaching my plate. They wanted to know what I'm eating. Medical comedy.
Medical comedy.
Yeah.
Most of the medical professionals don't have the time to educate, or they are not willing to educate common people to take charge.
We don't have time. That's why I'm slightly against carnivore diet. One thing that we always say is it's not only the number of vegetables, it is also the types of vegetables and fruits.
Hello everyone, I welcome all of you to another wonderful, interesting and going to be quite an exciting conversation because today I have got with me one celebrity medical practitioner. At the same time, he's the one who is actually making a waves in the entire healthcare space by making health simple and cool. I have never seen anybody else who has made it so cool. So I got Dr. Pal along with me. Dr. Pal, welcome to the show.
Oh, thank you so much for having me. So that's so nice of you. Thank you.
Dr. Pal is here with me because we are together in the World Biohack Summit. And so how do you enjoy the World Biohack Summit?
It's very good. The talk on gut health was excellent.
Yeah.
And the talk was right before lunch as well.
Yeah, absolutely. Yeah. So people had a different perspective about the lunch before they were approaching lunch with a completely different...
No, they were not approaching lunch. They were approaching my plate. They wanted to know what I'm eating.
Oh yeah, that I noticed that. Yeah, that's interesting. Yeah. Anyway, I really want to know, because not many people know. I'm not going to ask many medical questions. I just wanted to know how come you get into the space of educating people about health, that too in a very simple, more funny way.
So coming into social media was an accident.
Can you just throw some light? How did you get into social media?
Yeah. So
because now you are a superstar.
So coming into social media was an accident. 3-4 years ago when COVID started, my wife was stuck in Chennai.
Okay.
I was supposed to go...
Actually, you were in the US.
I was in the US.
Yeah.
We had our second baby.
Okay.
And as usual, do you know IAS? IAS means Indian Ayah Service, which means that my mother-in-law will come and stay for 3 months.
Yeah.
And then my mother will come. There's no support in US.
Oh, that's IAS was going on.
Yeah, IAS was going on without any problem. The COVID came and the problem got really aggravated.
Right.
Because the plan was my wife and my mother-in-law and all my kids were in India on February 25th.
Okay.
The plan was I'll finish the call week and then I will join them in Emirates in March first week. Mm-hmm. Right there, COVID happened.
Right.
It was a block and there was a huge pandemic. And one of my non-profit organization asked me to do a educational video. Okay. They called me and then they said, you're not doing anything anyways. Your family is gone.
And you were in the US?
I was in California.
Okay.
We will provide you food. You give us a video. I said, oh, that's a wonderful deal. I'll get the food. I'll give you the video.
Yeah.
So I used to do stand-up comedy on the side.
Oh, is it?
In Tamil, native language.
Really? So how many years you have been doing this?
So I just started because it was a comedy club that opened in Bay Area.
Okay.
It's called Building 18.
Uh-huh.
So basically, I just go there. I don't prepare anything. I just vent out my medical frustrations on the audience.
Yeah, I understand. I understand.
All these Google questions, what's up university, ChatGPT. Oh my God. I said, okay, I'll just go on. So I liked it. And I used that experience and then wrote a 10-minute script and then I shot it and then sent it to them. They looked at it and they said that we cannot publish this because this looks like a stand-up comedy video.
Oh, that is your first experience, huh?
The first experience, it's not a professional. We want a professional doctor, serious talk.
Okay.
I said, dude, I spent like 2-3 hours on this. What do I do? And he said that, put it in YouTube. Only then I know that anybody with a Gmail account can have a free YouTube account. Until then,
I think, doctor, you have to repeat it again. That's the only time you came to know that somebody can, with a Gmail account, can open a
YouTube account. To be honest,
3 years back.
3 years back, I was thinking to create a channel, you need to pay $10 per month for the YouTube Premium.
You have to pay to YouTube.
I was thinking like that.
Yeah.
Because I'm from Madurai, I don't want to pay $10. I mean, from how I grew up. I said, no, I'm not going to use YouTube. Why should I pay? So then I realized that, okay, anybody can upload. So I uploaded it. Overnight, that video became viral than the COVID virus itself. because of the timing.
What is the subject of that?
I said, hey, don't worry too much about the COVID virus. It is not a big deal.
Okay.
As long as you do vaccination, you wash your hands, you maintain 6 feet, it's not going to kill you. I made that in a very
In your own style.
in a funnier way. But at that time, COVID hit India very badly in that time.
Right.
Because 2 weeks before, US was hit. 2 weeks later, India was hit. And at that time, my video was a breath of fresh air because everybody was so scared. So it got forwarded in multiple WhatsApp groups and everything. So that's how I came into social media. Then I left for 1 year because I said, okay, maybe it's a one-time trick. It worked.
Okay. So that means the first video went viral, and after that you didn't.
After that, I didn't do anything. After that, I did a video. It was only like 500 views. Out of that, 499 was me.
You were trying to check it out whether somebody is watching or not. I like that.
Then
I
I
like
realized
that,
that, okay, this is not going anywhere. And it took a lot of time to prepare, edit and all those things. Like, forget about it.
Okay.
So then, fast forward to January 2021 is where the first vaccination happened.
Okay.
So out of pure good intentions, while I was getting vaccination first because of physician, because of being a physician, I did a live streaming. That, guys, look at this. I'm getting vaccinated. You also get vaccinated. You protect yourself from COVID. And that got viral again.
That also must be in your own style.
My style. Yeah. It was a live blog. Live blog. And even I said that if you get a one COVID vaccination, I'll give you one chicken biryani free.
Okay. Okay.
The first comment was, where is the chicken biryani?
Yeah, of course. Let's decide where I'm going to get it. Yeah.
So then, actually, at that time, people were dying in India because of lack of COVID vaccination availability and also not understanding the importance
True.
of it.
I remember.
So I got a note from somewhere, Tuticorin somewhere, from a very nice letter written in Tamil, that because of your video, I had my parents vaccinated.
Okay.
And they are surviving, but my neighbor's parents who didn't vaccinate it did not survive.
Okay.
And it was so emotional. And at that time, I was realizing that the power of social media is like so huge, where a person from Tuticorin can get benefited.
Oh, yeah, that's right. Yeah.
From a person sitting
Who
in
has never
Sacramento.
seen you.
Never seen me.
Yeah.
Nothing. So then I realized that, okay, so this is a medium. I'm going to spread good information. Then after COVID, I talked about my own weight loss journey. Then we talked about intermittent fasting, gut health. And it just combines my passion of script writing plus medical information. So we put together a genre called MedCom, medical comedy.
Medical comedy.
Yeah.
I think that word is coined by you.
Coined by me, yeah.
Look at
Coined by
that.
you,
That's
MedCom.
great. That's great.
To a point that everybody is expecting some kind of comical delivery on every video.
Yeah.
In one video, I said smoking causes pancreatic cancer, kills you in 3 months. And the first comment is, Doctor, where is the joke?
Where is Arogya Swami? I know. The hero. Yeah.
So
That's
how
so
it's-
nice. In fact, actually, that's where you made a big mark in this entire space of communication, because medical health, all those kinds of things are, number one is serious. It's dry. So you made it very lively.
Oh, thank you.
Yeah,
Thank
yeah. I think with anyone with whom I talk, they all understand it from a completely different angle. And when we talk about biohacking, like hacking your own biology or helping people to take charge of their own health and well-being, I don't think anybody else can do much more than what you're doing, because you're helping people to take charge of their own health and well-being.
Right.
So let me ask you a question, doctor. Is it because most of the medical professionals don't have the time to educate, or they are not willing to educate common people to take charge?
We don't have time.
They don't have the
To be honest,
time.
we don't have time at all. I'll just tell you an example of a medical practitioner in India. So he opens up a clinic,
Yeah.
and let's say he starts at 6 p.m. Between 6 p.m. to 9:30 or 10 p.m., people see close to like 25 to 30 patients.
Yeah.
30 patients. And when they come in with, let's say I have headache and I have, they do a good job in analyzing that particular symptom alone, and they
Yeah.
treat very well. But they just don't have the time to go deep into get to the bottom of it, like why the headache started initially.
That's true. That's
And
true.
then they say, diet, lifestyle, but the patient doesn't know how to do the diet and all those things. So they don't have the time at all. This is an Indian practice. I'll tell you what is happening in US corporate based practice. So I start my day at 8 a.m. I finish by 5 p.m. 8 a.m. to 5 p.m. I see like 20 to 30 patients, which is good.
That's good, yeah.
Every patient gets
Yeah.
like 15 minutes of my time.
Yeah.
But in that 15 minutes, I not only see the patient, I document what I said.
Okay.
I submit that documentation encounter to the insurance company for billing purposes, so that the corporate company gets paid, so that he pays me. So all this should happen within those 15 minutes.
Okay.
So again, time is of a big essence. So for example, people come to me with gut health problems. And as I mentioned in the talk, when somebody says I have bloating, the first thing what I ask is, when do you sleep and when do you wake up? Right? So that itself will take like 15-20 minutes to understand the sleep rhythm. Then we need to go into the food. Every GI consultation will take an hour. But our corporate system will not allow us to do that.
You're not getting that much time.
They will not allow us to do that. Yeah. Some people actually do the 1 hour consultation. Some people actually takes the time, evaluates it all together, and then they get a lot of satisfaction out of it. But that particular doctor cannot work in a big corporate system, because that is not a sustainable business model.
Yeah, yeah, yeah. Now, as you are a gastro specialist, and I think the importance of gut health, the last 3 years, people have started realizing, or rather, the kind of knowledge people are gaining is very high, and people are becoming very curious to know. So, any reason why people have become so much aware about the gut health, and people started thinking about, okay, if it is depression, it's not just in your brain. First, you look at your gut. So how come people started realizing that gut is so important?
So even as a gastroenterologist, only in the last decade or so, we're talking about all this gut bacteria a lot more.
Okay.
And not before that, right? We have been talking about it, but not as much as now, because there was a big genome project that they created.
Yeah.
Similar to how we have dissected the human genome,
Yeah.
we have done a microbial genome as well. It took like 14, 15 years for us to complete it. And the idea was similar to how we gathered the human genome information. We thought that, okay, if we get all the information from all the 100 trillion bacteria, we'll be able to make specific changes to actually cure diseases.
Right.
That information is available in the last decade. So people started analyzing, oh, maybe this bacteria is down, this bacteria is up, let's try these different things.
Yeah.
What we are experiencing right now is the data is so vast that it is very difficult to individualize for a particular person. And that is why people are talking a lot about gut health, because it is still scratching the tip of the iceberg.
So when do you think that we can gain more precision on this?
So eventually what will happen is, as you know, every gut bacteria is like a fingerprint, right? So you have a different gut bacteria profile. I have a different gut bacteria profile. So there will be a time, maybe, like 5-6 years from now, if very optimistic, where we'll say that, Dr. Sajeev has heartburn. Okay, so for heartburn or maybe abdominal bloating, so this bacteria
Could be the reason.
Yeah. And let's supplement this.
But doctor, I always have this question in my mind, that a country like India, where if you look at it, we have south, north, east, west. In south itself, we have got Tamil Nadu has got a different food culture. Kerala has got a different food culture. I'm sure that the microbiota also changes as per the kind of food you eat. So would you be able to achieve that level of accuracy in a kind of a country like India, where I would be able to precisely say that, a person from Tamil Nadu is having this kind of a problem, gut-related issue, and, what kind of a food must be causing it? Is it possible?
It is definitely possible. The answer is yes. But the journey is going to be very long.
Yeah.
Because your gut bacteria is influenced mainly by the environment that you are in.
That's it. Yeah.
You are in.
Yeah.
So if you migrate from India to US, there is certain amount of gut bacteria that is being lost, and that is being proven in Hmong community, Hmong. It's a community in Thailand and Burma, where they moved from Thailand, Burma, and all the way to Minneapolis in US. And they looked into all this stool analysis, and they were surprised that within a span of 2 to 3 months, the gut bacteria profile has almost changed like 20 to 30%. So just with the migration alone. So there are lots of factors that influences the gut bacteria. And one common thing, if you see, if parents are healthy, they are eating right, most of the times the kids also are healthy because they see what they are eating, and
Yeah,
on the
exactly.
top of it, the gut bacteria is also being translocated somehow by touch, by in the same environment. Examples like that would actually indicate that there is a common environment that will actually stimulate good gut bacteria if the environment is good.
That's wonderful observation. And in the US, I believe the fecal transplant is becoming common now. So, what is your experience, or how do you see that process?
I do a fecal transplant myself.
Oh, okay.
Yeah,
Okay.
so I do fecal transplant on patients. So it is being approved for an infection called Clostridium difficile, C. difficile bacteria.
Yeah.
And that is the only approved indication for fecal transplantation now.
Oh, only for that particular bacteria. Okay. Okay.
Only for the particular bacteria which is causes fulminant colitis.
Yeah.
You do a fecal transplant, things get better. All the other steps are just in baby stages. We cannot approve clinically as of now.
But I have heard this, and also I've read somewhere that the moment you're doing a fecal transplant, suppose you are getting the donor is obese, and the person who is receiving, chances of he also becoming obese is high.
It's possible, yes. There's a report of that as well. Yes.
Yeah, that. So, do you think that in India, it's this process will happen soon?
Not for other conditions.
Okay, only for this
Only for
particular
sickle
bacteria.
colitis for sure, but eventually it will happen. But it needs to be streamlined very properly.
Yeah.
So taking a stool from somebody else and giving it to somebody
Yeah,
else,
yeah.
sounds very easy, but it's a lot of intricacies involved.
Absolutely. Absolutely.
Because that gut bacteria could do anything
Yeah.
in your recipient.
The donor definitely must have to go through so many tests before. Yeah.
Correct.
Yeah.
Correct.
And interestingly, one thing I just want to ask you, because microbiome testing is happening in India also, but level of accuracy is one big question. Now, for a common person, common man who is living in India, how can I make sure that I'm feeding my good buddies?
That's why I always say lots of fruits and vegetables in your diet. Lots. That's the only thing that you need actually. And that's why I'm slightly against carnivore diet.
Okay.
So, just pure meat is not good for the gut. Meat is okay, but not just meat alone.
Lots of vegetables and fruits are a good idea, but getting the quality fruits and vegetables is also a challenge, right?
It's a-
That's where people look at some of the resorts like the supplements.
But the one thing that we always say is it's not only the number of vegetables, it is also the types of vegetables and fruits.
Okay.
So let's say that you have you're taking 2 apples. It is much better if you take 1 apple and 1 orange and not take 2 apples together. So
Because you're feeding different
different varieties.
stratas, that's the reason. So is that the only one? How about the intake of fiber? How about the intake of certain amino acids which can actually can have an impact on the microbiomes?
So this is the only proven evidence that it's very clear that this acts as a prebiotic and feeds the good gut bacteria to release whatever the substance that they want to do on your gut, promoting the gut health. This is very, very proven. Multiple studies have shown this. Whether the fruits and vegetables are of good quality, whether you're able to afford it, good quality fruits or expensive, those are all different questions to answer.
That needs to be answered separately.
Answered
Yeah,
separately.
I understand.
But in general, maintaining a good gut health is not as bad as what people think.
And there's been a lot of discussions about the antacids, The moment somebody feels like acidity, they jump on and they just buy an antacid and pop in. So, and is that a good idea, or What is your take on this?
So when you have acidity, which means that the stomach is secreting more acid than needed.
Okay.
So either, which means that the brain gut axis is not working properly, or the feed to the bacteria in your gut is not happen properly. But for both, the answer is to relocate and redistribute your gut bacteria. So yes, you need to take the antacids for symptom improvement.
Symptom improvement. Yeah.
If not, the heartburn is going to be there.
Yeah.
And it is okay to take antacids in a short-term basis if there is real symptom improvement. But whether it is a good thing on a long-term basis, we don't know. Because it does have some kind of side effects if you take it for more than a year. So what I do in my practice is I give antacids, and in the meantime, I tell them the actual things to be done.
It's only symptom. You are actually curing the symptom only. Yeah.
It's just a band-aid.
Yeah. Now that you are doing a lot on the social media in terms of education, especially making people aware about living good, healthy living. What is your mission ultimately now?
So I strongly feel that medical profession itself is targeting only after the disease happened.
Yeah, the curative side.
So I strongly believe that gut is the problem for every disease. So my goal is, I come across as a very strict person on social media that you should not eat this, you should not eat that. No, nothing after 7 p.m. to a point that people are actually having my face in front of the kid, and then they say, you eat it, if not good, send it to Dr. Pal.
Yeah, I understand. Yeah.
The reason that I am that strict on social media is if I say don't eat pizza, nobody's going to listen to it. They're still eating pizza.
Yeah.
But at least the thought process will be there. Maybe we are eating too much.
Yeah. Correct.
So my goal is that if somebody adopts this lifestyle of conscious eating and mindfulness, and if I change a particular person, I'm sure that their whole family will change eventually, and I can prevent a big disaster in that family.
That's really a practical way of looking at things.
Right.
Anyway, thank you, Dr. Pal, for sharing some of the thoughts. And I don't require to tell you that Dr. Pal's a little bit of kind of knowledge what he has shared with us. From that itself, we can make out that what he talks about is all practical. Something which not like strict. Something which I cannot practice. So so I think you are not allowing people to have an excuse.
Yeah.
So
no, I'm telling, give a valid excuse.
Yeah, wonderful. So thank you very much, Dr. Pal, for being with us.
Oh, thank you, sir.
Thank you.
Thank you for having me. Thank you.